DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us today on DocTalk. We're going to have a great show. We're at the Kansas Department of Agriculture with Dr. Justin Smith. We're going to talk about high-path avian influenza and everything that's come through our industry and talk about maybe where it's going to go. Thanks for joining us. We'll be right back.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I'm here with Dr. Justin Smith, and he is the Kansas Animal Health Commissioner.
That's correct.
Here in the state of Kansas. He's a veterinarian. He's been in veterinary practice, and he is a leader in our state, and a leader more than just our state. We appreciate all that you've done for us and continue to do in your service to animal agriculture.
Well, thank you, Dan. Very much appreciate that. And yeah, great to visit with you this morning.
That's great. So you've been heavily involved, obviously, with, whether you want to or not,
Very true, very true.
with high-path avian influenza. And we've kind of stayed away from it, but it's really time that everybody kind of hear, what it is, where it came from, what's going on with it, and then maybe where we're going to go. But kind of give us let's start out with just the background of obviously high-path avian influenza means birds and highly pathogenic. So what kind of give us a,
Sure. So yes, high-path avian influenza, or HPAI as we reference it, is an influenza virus that frankly is going through the bird populations out there. And so it's one of those things that's not unique. I mean, we see it routinely on every so often coming through the European and up down through the Canadas, and then obviously impacts the United States on an occasional basis. This most recent episode that we're dealing with started back in 2022 when we started seeing some birds that were exposed to the HPAI virus. And when I say birds, our domestic poultry birds. And we were seeing some death loss, particularly up in the northern Minnesota, Dakotas, and all that in our turkey population. We know that the wild birds or the migratory birds are the resource of this virus. So they have the virus and they tend to spread it to our domestic flocks.
and they'll spread it to some of the wild birds that hole up in our,
That is correct. Yeah.
like starlings and.
Yep, exactly. So we have seen it in some of what we call peridomestic species, namely the starlings and the sparrows, if there's a high exposure with that. But in general, the large mass of migratory birds come through is our virus load and our virus source of that virus itself.
Okay, and so then when it hits a turkey flock or it hits a egg laying facility, it's not good news, is it?
Not good news. It is, first of all, it's very detrimental to that flock. I mean, we see tremendous amount of sickness and tremendous amount of death loss, and that's why it's called highly pathogenic. There's a lot of pathogenesis that goes along with that virus. So it pretty much decimates those flocks, but at the same time, it is considered a foreign animal disease, and so from a international trade impact, we have to get those birds off the face. We can't allow them to be carriers of that virus. And so, it's basically, we decimate those flocks.
Yep. We're going to talk about seeing it in other species in the next segment. But we continue to see issues in the poultry.
Our hope is that somewhere during the process that virus reassorts and becomes non-pathogenic, but that hasn't been the case over the last 2.5 years. And so we continually to see birds flocks being impacted. Just in case, Kansas, we've had several backyard flocks as well as some commercial game bird facilities in the state this season that have already been impacted with it.
Yeah. Well, it's a great start to the discussion on high-path avian influenza. When we come back, we're going to jump into what's going on in the dairy cows, some cats, different things to that nature. You're watching DocTalk. Thanks for joining us.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today, we're going to talk about getting those first calf heifers to breed back. Their success is our success. So here's how we can help them thrive. First, nutrition matters big time. These new moms have incredibly high nutrient requirements. So not only are they still growing, but lactation takes it to a whole new level. So in order to meet those demands, separating and supplementing them away from the mature cows is something we probably should be considering. Second, body condition score is key. Heifers with a body condition score of 6 at calving are way more likely to breed back on time, so let's make sure to be tracking that. Third, early breeding season is a win-win. Start the season earlier for heifers. Heifers bred within 21 days of the first breeding cycle are more likely to breed back, they're going to wean heavier calves, and it's even shown that they're going to last longer in our herd. And last, address energy demands as early as possible. Energy requirements at calving skyrocket almost immediately, and compensating for poor condition after calving is nearly impossible. So focus on the last months prior to calving to make any condition adjustments that you need to. So by nailing these couple points, we boost their breeding success, leading to a healthier herd, heavier calves, and a more profitable operation.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Justin Smith. He is our Animal Health Commissioner for the state of Kansas. It's a big job, and we're very, very fortunate to have someone that has the boots on the ground experience as Dr. Smith, as someone that's in the leadership role within our state. What really kind of hit was that this jumped from poultry to all of a sudden in West Texas and Southwest Kansas and Eastern Colorado into some of our dairy cows, correct?
Correct.
Can you kind of just give us a kind of a 30,000 foot view of what all kind of just, you know, just what had happened and where, and kind of the state of where we're at with the dairy?
Sure. From full disclosure, I will say this caught us a little bit off guard because influenza A's, which is what the high-path avian influenza is, doesn't typically affect bovine cattle or bovine species. And so it did catch us a little bit off guard. But at the same time, we recognized that there was an opportunity for certain species to become infected because they are susceptible to influenzas.
Yep.
And we had seen that in some of our wildlife out there. We had seen wildlife animals, foxes, skunks, raccoons, bobcats, all become infected with HPAI from exposure. But we all considered them a dead-end host, meaning that they didn't pass that on. Then in April of this year, we ended up having a syndrome going on in some of our dairy herds down in, like you said, the Panhandle, Texas and Southwest Kansas, that was really impacting some of these dairies. Wasn't causing the death loss like we see in our poultry world, but was definitely significantly causing some impact on these cows from a production standpoint and just from a health standpoint. And we were seeing it go through these herds fairly rapidly. Lo and behold, after some hard work and discovery, they discovered that it was HPAI virus that had infected these cows. The process is, what we think happened is there was some level of a reassortment that occurred on one facility that basically had backyard flocks as well as dairy. We don't know where,
Right.
but that it happened, and it was a one-time incident that had moved into the cows. And then from that point on, it's been a passage from cow to cow or dairy to dairy at that point in time.
And maybe I'm behind, but it seems to have an affinity to the udder.
That is correct. Frankly, honestly, as much work as they've done on these cows, that is only the place that we can find it's repeatable.
In a lactating dairy cow in the udder.
In the udder, yep. And we know that the udder itself is highly susceptible to it, as well as then the milk becomes a huge vector because there's a tremendous viral load in that milk.
Right. And then, so I think that it's important that you say, you know, that's low path, because even we have low path in birds too.
That is correct. Yep.
And it comes and the flock clears it, and the cows get it and the cows clear it, just like if we get the flu, right?
It's exactly right. Yep.
Yeah.
Yeah. No, this one is, like I said, did catch us a little bit off guard in the fact that the impact that it had on the cattle and the fact that it was only in the udder. We can't routinely go out and find it in a respiratory sample, or even, you know, they've tested every tissue there is on these cows, and the udder is the only one that's repeatable.
Perfect. And then, you know, we got here, you know, 30 seconds or so to go for commercial, but now we're seeing it in some cats.
That is correct. Yes. So again, right now the cats are a dead-end host that we're considering. But yes, the exposure of the virus to the cats, we are seeing some detriment in these cats, neurological disease, and frankly, it's lethal to them as well.
You can see he has a big job and a lot of responsibility, but learning more about HPAI, understanding what it is and what it isn't, is why we're here today. And we appreciate time with Dr. Justin Smith. We're going to take a break, and we'll come right back.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Justin Smith. He is the Animal Health Commissioner for the state of Kansas, and we're talking about high-path avian influenza. You know, we've seen some reports on human sickness, or you know, even this last week, one was reported a death. At least a person had it that died.
That's correct.
What are some of the comments that a person should, if you were sitting there as a producer, what would be your thought process?
Sure. So I think the first thing is we got to recognize that still today, CDC classifies this as a very low risk in the human world. But at the same time, much to what you said, we know that it can infect humans. And so if you are in a position to where you have exposure to birds or even dairy or dairy milk that may be infected, use the precautions that you need to use, namely a mask and eye protection and gloves. With that said, if you have a herd that you're suspecting may be infected, that is showing dramatic milk loss, showing sicknesses with that, get your cows tested, get your milk tested, and do the right thing. Just the normal exposure that we have in dealing with your cows or your beef cows or whatever, again, the risk is very low. All the cases that I know of have all been related to the fact that they had exposure or high exposure to the viral load.
Yep. So it's mainly dairy animals, not necessarily out on our, Montana ranches or.
Correct. Yep.
And I think that the other one that was important is, if you do have that backyard dairy cow with the backyard chickens, probably stop drinking the raw milk, huh?
Very much so, yeah. Again, from the aspect of the raw milk consumption, we know that milk potentially has a high viral load if that animal is infected. We don't know what a large intake of that virus does, but we do know that humans can get it. So, for more than one reason, make sure that
well, there's other things
exactly
that you and I both know about, salmonella and campylobacter,
exactly.
and so all those things So what about commerce? What has been the biggest impact that this has had on commerce in the industries?
The very fortunate thing to this, if there is a silver lining to this, that we were early on able to prove that the milk, the normal pasteurization processes in milk rendered it safe, that we did not see that virus continue through the pasteurization process, much like the same through our meat inspection process, that the end product is not infected with this H5N1. So that's been the great thing. And so that has helped us maintain our commerce capabilities from a local's perspective. Now, with that said, there has been an impact on some commerce of the live animal. Yep. Namely the fact that USDA issued a federal order stating that a certain amount of testing had to be done on animals, that were particularly lactating animals.
Sure.
We've all concentrated on that lactating animal. But from a commerce perspective, it's been relatively minor from the dairy world. Obviously, from our poultry world, it's impactful and doesn't allow us to ship internationally if we don't take care of it. But we haven't seen that impact in the dairy world as of yet.
Yeah, and I think that's a whole new, the more I learn about exports and negotiating, it sometimes can be very political rather than science driven.
Very much so.
Right?
Very much so, yep.
And so we just appreciate all that you do, appreciate what our federal and state and local officials have done to really get your hands around this. It's been a tremendous win, in my opinion, to show what the system and the people that we have on the boots on the ground and in leadership roles getting our hands around this and getting it under control.
No, I think you're exactly right, and I appreciate that perception because if cool minds will prevail, we can get things figured out, and it'll take us a little bit of time, but we can get it figured out and do the right thing.
It's awesome. We're going to take a break. When we come back, we're going to talk about what's next with HPAI. It was Dr. Dan Thompson with Dr. Justin Smith. You're watching DocTalk.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, Dr. Dan here with Dr. Justin Smith. You're watching DocTalk, and we sure appreciate you tuning in. Dr. Smith is the Animal Health Commissioner for the state of Kansas, and we have been talking about high-path avian influenza. We've talked about its origin. We've talked about it in birds, cats, cows, kind of, what you'd look for in your cows, make sure we get tested, human safety, commerce, and I guess now, what do you see as next? What are the impacts this has on our animal agriculture industries?
Sure. So I think, obviously there's a lot to be learned yet. We've learned a lot, but there's a lot of stuff that we don't. I mean, frankly, we don't quite understand yet how it's passing within a dairy itself. We know that, biosecurity lapses may have allowed it to enter that region and allow it to enter that dairy, but it moves through the dairy too fast to be strictly that. And so we've got to better understand how it's moving through those dairies.
Yep.
We've got to better understand what biosecurity we can put in place to remedy that or to mitigate that concept. We also need to keep our ear to the ground and looking out for what other incursions might be out there. We still know that we have HPAI in those wild birds, and it happened one time. Can it happen again? And what does it look like when we get it into our other species, if it gets there, from the swine world and from the beef world? Frankly, we haven't had an impact from the beef world yet to this point, to our knowledge.
Right.
No real rationale of why it hasn't gotten into beef herds, but at the same time, we haven't seen that there. And so I think it's those things that we have to keep looking, we have to keep out there, and we have to make sure that we don't dismiss anything that might be potentially out there. But at the same time, we said it earlier, is we got to do it with a very precise and a cool mind to go about through it and to understand that we don't panic in this world.
Yeah, it's kind of like being between breaking into jail and putting your head in the sand, right?
Yep, exactly.
Is where we gotta be.
Yep.
We don't want to create an issue if it's not there, but we don't want to avoid one that we need to mitigate.
That is exactly right.
I think it gets back to it, folks. If you think about your state, federal, local officials and their job, I mean, this is an example of why we do what we do.
Very much so.
And having a cool head. And, we get stuck on watching one news channel or the other, and depending on what you watch, the sky is falling or there's no issue. And we all know reality is that this is an issue, but you know what? It's one we're controlling.
It is controlling, and that's the thing. I mean, yes, it impacts those dairies, impacts those cows, but they do heal up. They do come back. We don't know what the long-term effect is this going to be. We're too early in that process, but what does it look like for those heifers that may have been impacted and look like down the line? We haven't touched on vaccine. There's some vaccine candidates out there available. From a trade issue, we got to understand what that's going to do to us if we happen to implement that. So back to your comment about political versus science. I mean, we know we have some science out there available to us. We just got to navigate that political and that component as well to understand what the long-term effects from an international trade component might look like.
It's perfect. Thank you so much for taking the time today to be with us.
No, thank you very much. Great opportunity. Appreciate it.
Yeah, it was great information. And thanks for watching DocTalk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson here at the Kansas Department of Agriculture with Dr. Justin Smith, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.